so much for joining us for today's Needy Med special topic webinar, RemediChain, a new kind of medication reclamation program presented by our partner, Good Shepherd Pharmacy. And before we get started, I'd like to offer some tips, as I usually do during our presentations, so that attendees can make the most out of the presentation. So first of all, if you do have questions, you can feel free to ask them at any time by typing them into the questions section of your GoToWebinar control panel. Just know we do reserve answering questions until the end of our presentations, but if we don't get a chance to answer your question, we will follow up with you by email. Of course, I will provide our contact information and the contact information for our organizations at the end. And also let you know that today's webinar is being recorded and will be posted on our YouTube channel. You can also find our PowerPoint slide decks and other materials we thought you'd be interested in that handout section of your GoToWebinar control panel. So let's get started really quickly. For those of you that are not familiar with us, let me tell you what Needy Meds is all about. We're a national nonprofit founded more than 2 decades ago by a retired family physician, Dr. Rich Sagel, and his friend, Libby Overly, who was a medical social worker. What you're looking at is our mission statement. But simply put, Needy Meds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. What you're looking at is the homepage of needymeds.org. I always like to put this up because our website really is the face of our organization, and it also gives me a chance to point out just a few resources, such as that healthcare savings tab. And that's where you'll want to begin your search if you are looking for help saving on or affording your medications and other healthcare costs. Right next to that is the Education tab. And that's where you'll find educational information such as our webinars, our monthly newsletter, and you could order brochures, for example. In the beginning, I mentioned that today's webinar is being recorded and will be posted to the Needy Meds YouTube channel. You can find a link to that on the top right of our homepage with the rest of those social media icons. And I really do hope you subscribe. That way you'll be notified when new content such as webinars, videos, or presentations are added. That way you won't miss out on anything. I also mentioned that under that Education tab, you can see our upcoming webinars. Well, you can also check out and register for future webinars on the calendar of events, which is on the bottom right hand of our homepage. So as you saw a couple of slides ago, a big part of our mission is educating people. And we define that by educating people about Needy Meds and the resources we offer, but also by letting them know about other resources that we're confident they will be interested in, which is why we are so pleased to have Liz Robinson from Good Shepherd Pharmacy here with us today. So first, let me tell you a little bit about Good Shepherd Pharmacy. They're a nonprofit pharmacy that will help you with prescription drug prices. As easy as that. Now, I recommend checking out their website to learn more at Good Shep RX because it's a great resource. Because today's presentation is going to focus on Good Shepherd Pharmacy's RemediChain. RemediChain is their platform that allows individuals to donate unused medications to patients in need. And to walk us through how to use the platform and how using the platform can benefit so many, we have, again, my friend and colleague, Liz Robinson. She's a customer service expert who has worked with Good Shepherd Pharmacy since April of 2021. So without further ado, I'm going to go ahead and pass the mic and the screen to Liz. And as she goes ahead and grabs the screen and opens up her PowerPoint slide deck, which she did very quickly, I will remind everybody that if you do have questions, you can go ahead and type them into that questions section of your go-to webinar control panel. With that, I'll pass the mic to Liz. Thanks everyone for joining us, and enjoy the presentation.
Thank you for the introduction, Ms. Carla. Hello, everyone. Thank you for joining us for today's webinar. I want to introduce you to RemediChain, a one-of-a-kind medication reclamation program. To begin, let me provide some background information about who we are and the origins of our program. In 2015, Phil Baker, a local Memphis pharmacist, started Good Shepherd Pharmacy, a membership-based pharmacy dedicated to serving the underserved, uninsured members of the community. Good Shepherd offers uninsured patients access to a wide range of generic medications, brand name medications, and several types of insulin at affordable prices. If patients do not have a provider, Good Shepherd has several telehealth membership options as well. Shortly after opening Good Shepherd, Dr. Baker began seeing people frequently come into the pharmacy with bags of unopened, unused medications, in some cases very expensive medications, hoping to donate them to the pharmacy so the unused medication could go to someone in need. At that time, accepting medication donations from individuals was illegal, but it was from these encounters that an idea was born. Unused medications, a universal problem. Almost all of us have a cabinet or drawer full of extra, unused, or unneeded medications. The reasons for this are varied. Was the medication prescribed but ultimately not needed? Maybe the medication wasn't effective and your doctor prescribed something else. Perhaps the doctor wrote a script for a 30-day supply and you only needed a 10-day supply, leaving a mostly unused prescription bottle. Did the medication expire before you used it all? Maybe the reason you have extra or unused medication is entirely different. At some point, almost everyone asks themselves, what can I do with my unused medications? It's a unique question in the sense that while it applies to almost everyone, most don't know the best answer. Unfortunately, most people will choose to dispose of their unused medications, and many of those will do so in a manner that is not environmentally friendly. The good news is that now there is an effective resource to help answer the question of what to do with unused medications, the RemediChain program. We hope that our efforts of the past few years will offer a solution that helps everyone. In 2019, Dr. Baker successfully lobbied the Tennessee State Legislature to enact new laws that would finally allow nonprofit pharmacies like Good Shepherd to accept medication donations from individuals. In March of 2020, the RemediChain program was launched with Phase 1 limited to oral chemo meds and some specialty medications. RemediChain's mission is to split into two parts. The first, to provide an outlet where people can donate their unused medications to be matched with people in need at no cost to the recipient. Many medications are expensive and are not fully covered by insurance. By matching donations to those in need, we can repurpose costly medications and get them to patients who have dire need of them, but might not be able to afford them otherwise. To date, we've received almost 4 million retail value worth of donations, and we've matched meds worth over 700,000 to patients in need. This year, we intend to expand our program from chemo meds to include select brand name medications. The second part of RemediChain's mission is to take the guesswork out of safe medication disposal. Many medications are dangerous and they should never be thrown in the household trash where they will end up in a landfill or flushed down the toilet where they will go into the local sewer system. Many people aren't aware that the FDA has a list of do not flush medications and other guidelines for proper and safe medication disposal. Using the RemediChain platform, our system will help users locate safe disposal take-back centers, or medication drop-off sites. Now, let me take a minute to walk you through how our donation process works. If you have unopened, unexpired chemo medications you'd like to donate, the first step is to complete our online donation form. There are two ways to access this form. The first is to visit our website, www.RemediChain.org, and click the Donate Meds tab at the top of the homepage. You will then be redirected to our online donation form. The second way to access the online donation form is to text hashtag #FlipYourScript to 833-999-1003. You will receive a reply with a link to our online donation form and an informative video about our donation process. Once you've accessed the online donation form, follow a few quick steps to submit your donation request. Once we receive the submitted form, our team will reach out to you with further instructions and will provide a link for you to print a prepaid shipping label to use when sending the medication. If you have multiple medications to donate, please fill out a separate online donation form for each medication. Now we'll talk about how someone can receive medication. If you are struggling to afford your chemo medications or know someone who is, the next section will provide info on how you can register with us as a patient to receive donated meds at no cost. To register with us as a patient, please visit our website and click the Patient Registration tab at the top of the homepage. You will be redirected to our online patient registration form. Once you've accessed the online patient registration form, please fill out the form completely and submit it. Once the form is submitted, our team will reach out to you to discuss the next steps. Now we'll cover how to get a real-time view of our available inventory. To view our inventory of medications available to match with patients, please visit our website again and click the Available Meds tab at the top of the homepage. You will be redirected to our inventory app. The inventory app works with the Google AppSheet platform and can be viewed in an internet browser or on a device, such as a phone or a tablet. The app is free to download, but requires a Gmail to sign in to access. Once the app loads, you can tap on the Available Inventory icon to pull up the main menu. Here, you will view our full list of medications and the total quantity on hand for each medication. You can search through the list of medications by scrolling up or down or by clicking the magnifying glass icon in the top right corner of the screen. The small arrow on the right side of the screen indicates there is additional info available in a submenu. For example, we'll select the medication Afinitor. We'll tap on the line for Afinitor to view the additional information. Once we've selected to view further information for our inventory of Afinitor, we see a breakdown of the available doses on hand with a sum of the quantity on hand for each. To view further information about our inventory for a particular dose, tap the line to access the next submenu. For example, we'll take a look at a 5 milligram dose. Once we've selected the submenu for Afinitor 5 milligrams, we will see a further breakdown of our inventory by expiration date and quantity on hand by expiration date. We can scroll left or right on this menu to see information such as an NDC, whether the medication is in tablet or capsule form, the drug manufacturer, and the drug manufacturer lot. Also, if you ever can't find a medication you were looking for online, you can always just reach out to us as well. And you can reach out to us either by our phone at 833-999-1003, or you can email us at info@remedichain.org. And so that is it. So I want to thank you for taking the time today to learn more about our program. And again, if you'd like more information or have any questions, please reach out to us by either phone or email.
Liz, thank you so much for that very thorough explanation of not only what RemediChain is, but how simple it is to use it. I think that's the thing that always strikes me about both Good Shepherd Pharmacy, the nonprofit pharmacy, um, and RemediChain, this new medication reclamation program, because both of the websites and the process were clearly a lot of thought went into it to make it easy to understand, but more importantly, easy for users to actually use these platforms. So thank you so much. I do want to remind everybody, and don't worry, I know Liz had the contact information for RemediChain up just there. I will put that up again at the end of the presentation. I'm happy to see we do have some questions already coming in. We always like when our audience participates. And a reminder, you can submit questions by typing them into the questions section of your GoToWebinar control panel. And before we get to those questions, and it looks like there are some already coming in for Liz, I want to remind everybody that Needy Meds is here to help if you are having trouble affording your health care expenses. And again, to find out more information about that, there's a number of ways you can do it. First of all, you can simply go to needymeds.org, click on that healthcare savings tab. A drop down menu will appear, and these, what you're looking at on your screen right now, are all the different categories that are under that healthcare savings tab. So you can check those out. You can also reach out to our call center counselors, or you can join us for Needy Meds overview webinars. We try and have them at least once a month. Let's see. I also wanted to mention you can contact me directly if you do have any questions about Needy Meds or the information I shared about Needy Meds in today's presentation, or visit our website, needymeds.org. And of course, as promised, on the bottom right hand of your home of your screen is the 800 number to our call center counselors. They are available Monday through Friday, 9 a.m. to 5 p.m. We are in Massachusetts, so just keep in mind that that is East Coast time. And of course, there is all the contact information. On the left is for RemediChain, and on the right is Good Shep RX. So, Liz, we're going to go ahead to get to those questions coming in. And just at a quick glance, I'm guessing these are questions you get a lot. And I'm really pleased that they're being asked because it gives you an opportunity to explain it and drive them home. And the first question coming in is, who exactly can actually donate to RemediChain?
Yes, ma'am. So that's a good question. So pretty much anyone within the United States can donate medications. And by anyone, it could be either the patient themselves wanting to donate any unused medication they may have, or it could be a relative of a patient. It doesn't necessarily, the medication doesn't necessarily have to be in their name to donate. Or we've had providers who also donate medication for their patients as well. But again, anyone within the US can donate medications to us.
Great question, and very simple, straightforward answer. Of course, if you're like me and all the questions come flooding into your brain as soon as the presentation is over, you can reach out to RemediChain or Good Shep Pharmacy if you do have other questions. But the next one coming in right after the who can donate, what exactly can be donated is another question coming in actually from more than one of our attendees.
Yes, ma'am. So another good question. It is a question we get asked a lot. So what can be donated? Currently, as we explained before, the program is fairly new. So we are currently taking chemotherapy medications and some specialty medications, kind of a case by case. But the medications have to be unexpired, at least not expiring within the next 6 months that they're wanting to donate them. They need to be in a foil sealed manufacturer bottle or a foil sealed blister pack. We cannot accept any regular pharmacy bottles that come in like the amber vials, because those are open and the integrity of the medication, we don't know what's happened with those if the bottle is open. So again, they have to be unexpired within the next 6 months, foil sealed in a manufacturer bottle or a blister pack. And the blister pack, because each pill in a blister pack is individually foil sealed, there can be some missing from them. As long as the remainder of the pills in the blister pack are still foil sealed and intact, we can accept those.
So important. Such a great question. And I also want to mention check out that RemediChain website because you will find this information there. And I think you'll really be pleased with how straightforward the website is and how easy it is to understand how to make a donation. Which actually, it turns out, we've been these couple of questions has focused on the donation portion of RemediChain, and this next question is going to flip it a little bit because the question is, um, do I have to qualify to receive medication?
Yes, ma'am. So another good question we always get asked as well. So to qualify for these medications, they do differ from state to state because each state has different legislations in place on donating medications or receiving donated meds. So like I said, each state is different. Some may require, has to be at a poverty level of 300%, or one state may require that they must have no insurance at all. Again, each state is different. Um, each person is a case by case situation. So we will always, when it comes to that, we'll just figure out what state they're in and we can figure out the legislation there and then go from there.
Fantastic. Again, I'm so glad that the audience participates and asks these questions because what I always find myself saying is that if somebody who's listening in and joining us is thinking of something, the chances are there's somebody else in the audience that has that same question. And it always gives us and the presenter an opportunity to drive some points home or to clarify some things. So, with that, I do, as always, try and keep the question segment of these presentations brief. So, we're going to go ahead and wrap it up. But I will remind you that if you do have questions, excuse me, if you did ask a question that we didn't get the chance to answer, you can always reach out to us directly at the contact information on your screen. But we, of course, will respond to your questions via email. With that, I want to thank my friend and colleague Liz for taking time out of her day to share her expertise about
Thank you.
RemediChain. Thank you, Liz. Her expertise with not only RemediChain but Good Shep Pharmacy with Needy Meds users. We're so pleased to be partnering with them because they offer such valuable services. So thank you, Liz, and thank you to our audience for taking time out of your busy lives to learn a little bit more about this important organization, Good Shep Pharmacy, and their new medication reclamation program. Thanks so much, everybody, and have a wonderful rest of the day. Take care.